Hi friends, welcome back to Coffee with Ravi. As always, thank you for the comments that you send my way and encouragement, and it's motivating me and also putting me on the hook to do a little better than what we did the previous times. Today my post is about what is acute pancreatitis, or what's the pancreas. It's a common condition. The pancreas is a gland that sits right approximately here behind the stomach, so it's more towards the back. It's a gland. It's got two functions. Function one is to help produce digestive juices, and those juices then get pumped into the bowel when we need it. The second function is it produces the hormone insulin. So when our blood sugar, when we eat and the sugar in the blood goes up, insulin is a hormone that unlocks the tissues and the muscles and other areas, allowing blood sugar to go in and for our cells to feed off that sugar. So it's got two functions. If there's a problem with the second one, that's diabetes and things like that, and our focus today is more on the gland itself. Inflammation of the pancreas is common. It's one of the most common reasons for hospitalization of a stomach-related illness. In 2014, it was one of the three leading hospital diagnoses for admission. There's about close to 300,000, or actually 280,000 annual admissions, costing about $2.6 billion per year in our country. In 2014 as well, about 3,000 people died as a result of that. The mortality for that is less than about 2% of the annual case, but it's a higher mortality than even getting, say, COVID. So it can be somewhat of a serious problem. There's three ways that this can be classified, which is called mild, moderate, or severe. And the difference is really the extent of inflammation. Just like with COVID, people who get mild COVID, the infection could be limited to the throat and less so to the lungs. But in a subsect of people, both COVID and pancreatitis and other diseases sets off a diffuse inflammation called systemic inflammatory response. In other words, the fire catches on in other parts of the body by different mechanisms, even though it didn't start there. In patients with moderate problem with pancreatitis, there's local complications, but they recover within 48 hours. And I'll go into what those are. In patients with severe, there is organ failure beyond 48 hours, as well as some complications. Now, there are some factors that are more associated with more severe pancreatic inflammation. Primary among them seems to be if you're younger, there's more obesity, there's associated brain changes or mental status changes, there's other medical problems that people have, and this systemic inflammation that I'm talking about, how do we know we have it? Our pulse rate goes up, we breathe harder, our temperature goes up, and the white count goes up. If all of these things go up, it becomes this diffuse systemic inflammation. Blood work can show that the kidney function starts going up and the blood becomes more concentrated. So the hemoglobin in the blood is an indicator. So in other words, we assess this by means of checking your pulse rate, heart rate, how severe you look, how ill you look, or how ill a patient looks, as well as these blood parameters. When we do x-rays in people who have more severe disease, there's lung infiltrates, and also in the abdomen, when you get CAT scans of that area, there's inflammation that spills over beyond the pancreas. What I have here is a photograph of a CAT scan. What you're seeing is the brightly lit in the middle is the spine at the back, and the pancreas is circled in the yellow band. I have two slides here. In slide 1, there's inflammation, and in slide 2, there's much more inflammation and damage to the pancreas, which looks a little more swollen. So the pancreas looks like this banana-shaped structure that's wrapping around the spine at the back. What causes the pancreas to be inflamed? The pancreas, believe it or not, is a very well-packaged organ where the juices are packaged and separated. But anything that disturbs this packaging causes the juices to then spill over into the rest of the pancreas and start eating the rest of the pancreas. So the body's own protective mechanisms are gone, the compartmentalization is gone, and as these enzymes, which are super powerful that help digest our food, get into our own tissue, then it leads to pancreatic inflammation. One of the important causes of this is obstruction. So if the pancreatic gland, which drains internally, and I have a photograph here of the pancreatic duct and the bile duct that meet into the bowel, if there is obstruction of that, either from a gallstone or cancer, what happens is that those juices, then it's like the tap or the sink getting clogged back up. And when that backup happens, the body's own internal digestive packages in the pancreas get disrupted, and the body starts releasing those juices within the gland itself rather than pumping it out. The second thing that can happen is alcohol. Alcohol is a very common cause, and other things like scorpion venom and certain fertilizers and drugs can do it. Sometimes, if the body's own cholesterol and lipid levels go high, it's called hypertriglyceridemia, but that's a mouthful. The body's lipid levels go up, and this can happen independently or can happen with diabetes. Sometimes infections can cause it. Sometimes, getting injured or gunshots, things like that. Sometimes it can be post-procedure. There's a procedure called ERCP that we do, where we go down the mouth and take out the stones, and sometimes as a consequence of that, pancreatic inflammation can be set off. Very rarely, there's a condition that can be hereditary. In other words, you carry a genetic background of having pancreatic inflammation. The next generation of children, etc., can get it, and that's called hereditary pancreatitis. The treatment for this is somewhat supportive. We generally want that inflammation to pass. You don't want it to get into the systemic inflammatory response syndrome. You want to be able to hydrate people. There's some data that if you give people a lot of IV fluids in the first 24 hours, it'll prevent this next level of disease, that moderate disease or systemic inflammatory response that I'm talking about. Of course, it can be very painful, so pain control is important. I think treating associated high blood sugars or the high cholesterol or triglycerides that I'm talking about, I'm using the word cholesterol somewhat loosely, but it's actually the triglycerides, which is a subset or which is a small portion of the cholesterol. Of course, if one has gallstones, treating the gallstones and trying to take the gallstones out, which are clogging the system, is important. And of course, if the calcium levels are high, or if there are other causes that I've mentioned here that can be treated, that will also help in treating the acute pancreatitis. So in summary, pancreatitis is inflammation of the pancreas. The pancreas is a gland that sits right below the stomach here. It's a digestive gland first and an endocrine gland second. It can present with pain, and the pain can be here, it can be severe, it can be long-lasting. So therefore, any pain in this area, I think the pancreatitis needs to be considered. It can go from just pancreatitis to pancreatitis associated with inflammation, and treatment is largely supportive: IV fluids, pain control, and of course treating the cause of acute pancreatitis. So thank you. I've covered somewhat of a big topic in a short time, but if you have any questions, please send it to me, call. This information is intended to empower you, of course, to take care of your own health. And thank you again for your continued encouragement.